Hello, hi. Today I'm gonna be performing a pulmonary function test checkoff. So when doing the test, we always ensure to give some instructions to the patient by holding or withholding their bronchodilator or inhalers for at least 4 to 6 hours, and even smoking for at least 8 hours prior to procedure. And then when they usually come in for the test, we always have to let them know that they should wear comfortable clothing, and also they should also take a light meal. So when they come inside the PFT room, we would always take note and obtain their height and weight, and then take note also their pre-assessment vital signs such as the BP, the heart rate, and then their respirations and their SpO2. And then once they're able to, before we start, we would also try to ask the patient with this pain assessment tool or the pain score using the facial expression or the number itself. So the reason why I include this every procedure is I would like to know if the patient is exhibiting any pain at all, which may possibly affect their performance. So at least we're able to gather some information, and then we would also take note with our test report. And then after that, we would also ask some questions to the patient, such as any lung history or any recent procedures that they have undergone, their medications, if current medications that they took aside from the respiratory medications. We would always get and ask if they're taking any medications such as cardiac drugs. So once we're done, we would always encode everything in the computer, and then we would also take note about their ethnicity, as it will vary with the test results. So once we're done with all those stuff, we will instruct the patient, and then we will coach them. So one of the important things to do is we would demonstrate in front of them, so that way they will understand. But prior to that, we will explain to them the procedure, so that they will also know why they were being undergone with this test. So one way to ask them is we will tell them like this test is what we call a single spirometry. So the reason why you were being undergone by this procedure is we would like to measure your airflow, how much air is going in and out from your lungs. So once we're done, we will always instruct the patient like sitting in the chair, if they're inside the body box, the plethysmography, or using the portable one. So they should be relaxed position with their laps on the side and their hands on the side, and then their chin should be straightened up, not like this. And then this is the mouthpiece. So when they put this one inside their mouth, make sure that they seal it tightly in their lips with their tongue here underneath. And then we would always put those clips on it, so that way there will be no leak in their nose. So first of all is we will tell them to do normal breath by using this demonstration. At least 3 or 5 normal breaths. So by looking at their chest rise or in the graph after the exhalation period of the patient, we will tell them to take a deep breath in. So we will also tell them like when you take a deep breath in, assuming that you're drinking soda and using a straw, so assuming that you're sipping it, take a deep breath in like that. And then after that, you should blow as much as you can, blow as hard as you can until you feel your lungs are empty. So our goal with that is for the exhalation time to reach at least 6 seconds. So when we blow out, we would also tell them like when you blow it out, imagine that you're trying to blow your birthday cake full of candles. So from taking a deep breath in, blow. Continue blowing hard until you feel your lungs are empty. So after that, if you take note on the graph, 6 seconds, instruct the patient to take a deep breath in like that. So after that, we will let the patient rest for a couple of minutes if they feel any dizziness or lightheadedness, and then if they can tolerate, we can also continue the test or the maneuver. So we would always do the test like at least more than 5 attempts by choosing the 3 best one. So after the pre-FVC maneuver, we would always give the bronchodilator. So after giving the bronchodilator, we would always ensure the patient to rest for a couple of minutes in order for the medication to take effect. And then after the bronchodilator test, we would reobtain again the post-FVC maneuver. So once we're all done with those, if the patient, we're able to choose the best results for the patient, we would always do the post-vital signs, and then we would always ask them again their pain score, and then we would always reassess them, and then once we're done, we can put our test report on what our observations is.